Tonight, we're taking a look at the coronavirus pandemic here in Rhode Island. If everything goes according to plan, this time next week, the state will no longer be under a stay-at-home order. But that decision is still not set in stone. Today, the health department reports another 17 people with COVID-19 have died. It's the highest one-day total in weeks. Nearly 300 people have died in Rhode Island since the outbreak began. There are also slightly more people in the ICU and on ventilators at the hospitals in the state, but more than 500 people have been discharged, and Governor Raimondo is hopeful that that number will continue to grow. Eyewitness News reporter Anita Buffoni joins us live in Providence now with more on what state projections look like now. Anita?
That's right, Kim. A new data model shows Rhode Island could see a decline in the number of hospitalizations in the matter of 2 weeks. The new forecasted numbers are drastically different to what a previous state model predicted. Saturday's data shows 333 people are now in the hospital due to COVID-19. That's a decline of about 20 people from Friday. Just 2 weeks ago, a previous model showed Rhode Island would be in a much different situation, predicting the state could need more than 2,200 hospital beds by May 3rd.
The worst case scenarios that we had planned for haven't happened.
The governor says closing restaurants and bars and the stay-at-home order had a meaningful effect on the state's trajectory. Department of Health Director Dr. Nicole Alexander-Scott says the data reflects decisions Rhode Islanders made when it comes to following social distancing and face covering mandates.
Each of us is helping Rhode Island as a whole follow the trend line that we as a state want to be able to follow.
The governor says there was a spike in hospitalizations around Easter and Passover.
So those are people who weren't listening or doing what they were supposed to do. And as a direct result, we saw an increase in hospitalizations.
How reopening the economy will impact COVID-19 cases moving forward is why Raimondo says she is taking it slow.
It's why when we start to reopen the economy, we cannot flick the switch. We have to turn the dial.
Even though the governor says there is some good news in these updated numbers, she is reluctant to share projections because she says they are highly sensitive to assumptions.
As we've seen in other states that are past their peak, the virus doesn't necessarily follow the course that they had predicted.
And on a conference call with reporters after the briefing, the Department of Health said 81% of those hospitalized have at least one unrelated condition, and 72% of those COVID-19 patients who died were nursing home residents. Live in Providence, I'm Anita Buffoni, Eyewitness News.